Hi everyone, it's Dr. Jhawar with Revive MD. I hope you're all doing well today. I'm back with more frequently asked questions about DPC. If you didn't have a chance to see my video from last week, take a look at that. It's on my social media pages and I will repost it again for those who missed it. But last week we talked about the things that DPC or direct primary care can guarantee that traditional insurance-based practices and insurance companies cannot. So today, one of the most frequently asked questions I get from prospective patients is, well, hey doc, I'm not really sick all the time and I only see the doctor a few times a year. So how would joining your DPC monthly membership practice benefit me? And would it? Well, for those of you who are generally pretty healthy, that's wonderful and great. But I hate to break it to you, as a nation, we are probably one of the most unhealthiest countries in the world. Reports after reports, year after year, show that the United States spends more on healthcare than any other nation in the world, but we have one of the poorest access and health outcomes compared to other wealthy nations. And that's because of our rising obesity rates, chronic diseases like diabetes and heart disease, tobacco use, alcohol use, mental illness, and we have one of the highest suicide rates as well. So, as a nation, unfortunately, we are not very healthy. So, I think in general, most of us can actually work on things to improve our current health and our future health. And it's nice to have a primary care doctor who can actually guide you the right way to do that with many different modalities. As we get older, our organ systems change and our bodies change, just like many other things, like our jobs, our stress levels, our sleep habits, what we eat, what we can tolerate, and sometimes our medications, and sometimes things change with our families too. All of these things can affect our health in different ways too, whether it's mentally or physically. So, in the event that those of you who are generally healthy do fall sick or get ill or something changes, wouldn't it be nice to see a doctor that already knows you and see a familiar face? That could be very comforting when you're actually not feeling well. Or wouldn't it be nice to just pick up the phone and talk to your doctor who already kind of knows you? Or email your doctor any questions that you might have? Wouldn't it be nice to be able to text your doctor instead of rushing to the nearest urgent care and waiting for hours to be seen? I think that these are many different reasons why DPC can be beneficial for those who are generally pretty healthy and for those who are not. But for my own patients who are generally healthy, I tell them that this is great. You look like you're doing pretty well, and I want to keep you that way. My goal is to prevent future illness from developing and future chronic diseases. So I like to work with my patients as an ally and let them know of things they can do to improve their future health, or ways that they can, be on top of screening guidelines so that we can, have some early detection of something if needed. So I think there are many benefits that a direct primary care practice can be for several patients and several people around the nation. And I hope this answers another frequently asked question about DPC. I'll be back next week with more frequently asked questions. Thank you.